Picture this. You wake up tomorrow with chest pain. Your heart is racing, your family is scared, but instead of rushing to the hospital, you're doing mental math. Literally calculating the cost of staying alive against your rent payment this month. This is not a hypothetical scenario. In 2017, a 26-year-old American named Alex Smith aged out of his parents' insurance. He was a diabetic and his insulin costed $1,300 every month out of pocket. So in order to make it to his next paycheck, he started rationing his insulin. And within 1 month, he died of completely preventable diabetic ketoacidosis. And this is only one out of 4.6 billion cases in the world that still lack access to essential healthcare services, according to these sources. But how can something as fundamental as life depend on how thick your wallet is? I have seen my own grandparents struggle to pay hospital bills for the person who raised them, my great-grandmother. Quality healthcare wasn't even available, let alone affordable. And ever since, I have grown up with the memories of the amazing woman she was. If only I had the chance to make my own memories with her. And this is when I realized universal healthcare has become a marketing force, and a price tag was put on a life. If I rule the world, universal healthcare would truly be universal. And according to the Universal Healthcare Coverage Index developed by this source, well over 50 countries have already achieved near perfect universal healthcare coverage. Countries like the UK in 1948, when they established the National Health Service. Brazil in 1988, when they made health a constitutional right. Thailand launched its universal healthcare coverage scheme in 2002, and Rwanda, which is a low-income country emerging from genocide, and yet it has still covered 91% health insurance. And if these countries across every economic tier can achieve universal healthcare, so can the rest of the world. And today I will show you exactly how. It is about time we create a personalized blueprint tailored for every economic reality. First, let's divide the world into 4 tiers based on their economic status. One size doesn't fit all, and one country needs to make the care affordable while the other needs to have the capacity to provide it in the first place. Second, this is where Zoran Mamdani's plan for New York comes to play. This is a strategy of progressive redistribution. We leverage the world's wealthiest citizens to close the financial gap in healthcare. We've accepted that education is a right. We've accepted that clean water is a right. But those rights are meaningless if there's no life to experience them. And let me be honest, when activists, policymakers, and international organizations talk about universal healthcare, they often present it as if there's only one solution for everyone. There isn't. That way of thinking has actually undermined progress in many ways. Here's what I've learned from examining implementation across dozens of countries. Achieving universal healthcare isn't about copying one country. It's about designing a system that actually works for every economic reality. And that starts when we understand the world as it really is. So instead of forcing one model onto everyone, we break it down. Countries fall into 4 tiers based on these 3 pillars: their ability to fund, staff, and sustain healthcare. Now, one of the most common global measures is the Human Development Index, also known as the HDI. It's helpful because it measures the broad human progress. It tells us whether a country is developing in a general sense. But that is exactly its limit. The HDI does not tell us whether people can actually access healthcare, whether the system has enough doctors, or whether people are being pushed into financial ruin trying to stay alive. That is why I created a different measure, the Healthcare Composite Readiness Score. Unlike the HDI, this score is specifically designed for universal healthcare. It measures not just wealth, but whether a country can fund healthcare, deliver healthcare, and protect its people while doing so. I have found a formula that places every country on a scale from 0 to 1, using a simple equation built on 4 factors, what I call the GHCW. G is the economic capacity. It includes the gross domestic product, the gross national income, the public-private partnerships. H is the healthcare access. It's the percentage of people that have access to healthcare right now. C is the cost burden. It's the percentage of families pushed into financial hardships just to stay alive. And W is the workforce strength. It's the amount of doctors and nurses available per 10,000 people of the population. Put together, these 4 factors gives us a clear, measurable picture of what a country can realistically support. And that score determines its tier. But countries aren't static, they're ever changing. So this system updates every 2 years, making sure that the strategy evolves with them. At the top tier, countries like Australia, Canada, or South Korea aren't trying to build systems from scratch. They're optimizing them. The focus here is efficiency, reducing inequality, and making sure no one falls through the cracks. In the middle, countries like Brazil, Jordan, or Saudi Arabia have the foundation, but not full coverage. Here, it's about expanding access, unifying systems, and making healthcare more consistent and affordable. Further down, in countries like Bangladesh or Egypt, the priority is more fundamental. It's about increasing infrastructure, strengthening primary care, and making sure people have access to basic services without financial risk. And then, at the lowest tier, in places like Haiti, Niger, or Chad, the goal isn't perfection, it's basic access. It's vaccines, maternal care, treatment for common diseases, and scalable solutions like mobile clinics and telehealth systems that can reach people faster. This is not a judgment of worth, but it is a practical way to match healthcare strategy to national capacity. Because universal healthcare doesn't begin when everything is perfect. It begins when we match the right strategy to the right reality. Now, I want to introduce you to a framework that will reshape the way you think about the implementation of universal healthcare. It comes from Zohran Mamdani, the mayor of New York City, and his central principle, affordability as the path to universal access. Mamdani's approach is brilliantly simple. You can't have universal healthcare if people can't afford the journey to reach it. You can pass laws guaranteeing universal health care, but if a single mother in a rural area is taking a day off work to travel 50 miles to a clinic, she simply won't go. So Mamdani's strategy isn't just free health care. It's about addressing the structural barriers that prevent people from accessing it. So how do we ensure that everyone has equal access? We leverage the wealthy. So instead of asking the poor to carry the cost of staying alive, we ask the countries to have their wealthiest citizens contribute through a progressive tax bracket. The exact tax bracket is determined by the country's economic capacity. It brings us back to our blueprint. The surcharge, which is an additional charge on top of the existing income tax targeting higher earners, can apply to the top 1% of earners in the wealthiest countries. While in the middle income countries, it can target only the top 2% to the top 5% of higher earners. Finally, in low income countries, this surcharge only targets the top 1%. The principle is universal, but the threshold matches every economic reality. And using the funds from this tax bracket, we make sure that the very social determinants of health, which are housing, food, childcare, and transportation, are secure and affordable for the vulnerable population. A tiered tax on the world's 25 million wealthiest individuals will generate about 300 to 450 USD. This is enough to bridge the financial gap in healthcare for every economic reality. But I already hear the objections. The tax on the wealthy will just drive them away. Governments will waste it, or it won't raise enough money. First, the capital flight argument. Yes, some wealthy individuals might threaten to leave. But here's the reality. Spain implemented a 3.5% tax on top of their 0.5%, and their millionaire population grew by 12% in 3 years. You see, wealthy people don't leave countries with strong healthcare, good education, and a stable economy. They leave chaos. And universal healthcare only makes societies more attractive. Second, it won't raise enough money. $300 to $450 billion from 25 million people in the world is more than enough to bridge the global healthcare financial gap. For context, the total donor aid in health in low-income countries is just $35 billion. There is still more. Governments will waste it. They say, fair concern. I agree, corruption exists. But this is why we ring-fence the revenue, 100% dedicated to measurable outcomes. Clinics are deployed, doctors are hired, and telehealth systems are developed. When the money is visibly transforming lives, accountability follows. And here's the practical truth. Universal healthcare is actually more efficient because when the fear is removed, people seek care early, and administrative costs are dropped by 50 to 80%. And let me bring this back to our first principles, because policies are meaningless if it is not rooted in something deeper. When we treat healthcare as a privilege, we're saying human worth is dependent on economic productivity. The WHO Constitution of 1946 didn't say the highest attainable standard of health for those who can afford it. It didn't say subject to market forces. It said a fundamental right of every human being without distinction of race, religion, political belief, economic, or social condition. And more than half of the world's countries have already implemented this into their constitution. This proves that this isn't fringe thinking, it's a global conscience. And if I ruled the world, universal healthcare would not be earned through wealth. It would be a right inherent to being human. Because a price tag should never decide who gets to grow old. No 26-year-old like Alex Smith should have his future cut short by the cost of medicine. And no grandchild should lose a great-grandma to unaffordable hospital bills. Thank you.